sixth UK patient has died after testing positive for COVID-19. Confirming the news, West Hertfordshire Hospital's NHS Trust said that the victim was a man in his early 80s who had underlying health conditions. He was being treated at Watford General Hospital, where he died last night. Well, we are expecting an update shortly on the total number of UK cases of coronavirus within the next couple of minutes. Before that, though, let's speak to our science correspondent, Thomas Moore, about the sixth fatality from COVID-19 in the UK. Thomas, what do we know this afternoon?
This was a man in his 80s, as you say, who was being treated at Watford General Hospital in Hertfordshire. And sadly, he died on Monday evening, according to the Trust. They say that they did have underlying health conditions. So it's beginning to follow a pattern that the 6 deaths that we have had so far have been older patients, and they've had these severe chronic health problems that has made them more vulnerable to the virus that causes COVID-19. Now, they say that he tested positive. None of them, in no case has it been that has the virus been the cause of death, from what we know, but certainly all these patients were positive for the virus at the time of their deaths, and that is significant.
Thomas, we've just had this from the Department of Health and Social Care regarding that update on the figures. They've just said today's figures will be published later on this afternoon, so later than expected. We are working hard to provide you with the latest information, and we'll tweet this out as soon as possible. That was tweeted literally a minute ago. As I said, we are expecting them sometime after 2. Now we're told later on this afternoon. What do you think we can expect from those figures when we get them? Oh,
it will show another big rise, I'm sure. We've had 319 cases now. And every day they were going up between the upper 40s or 50s. And that has been what will likely happen now as the outbreak accelerates away. We will begin to see these big increases. The cases are doubling every 2 to 3 days. At the moment. And we were warned by the Deputy Chief Medical Officer this morning, when she spoke on Sky News, that we can expect many thousands of cases here in the UK. Very much, it looks like we are following the trajectory of Italy. And of course, there we've seen huge numbers, and they are roughly 2 weeks ahead of us.
And what do we know about the geographical spread? Quite evenly last we heard, but the Department of Health and Social Care being quite careful about how much information they give about where it is at the moment.
They're being very careful about the information they release generally. Yes, a geographical spread around the UK. They're not telling us whether or not these people are acquiring the infection here in the UK. Not since last Wednesday have we had that information. Up until that point, they were telling us how many were caught abroad, in which country, how many that they couldn't find any source for here within the UK, because it's that which is the spark for an outbreak. That is where the virus is circulating below the radar, and that is the risk. But we're not being given that information at the moment. It is very much, trust me, I'm a doctor, I'm the Chief Medical Officer, and I'll decide when we move forward onto the next stage, and that's when the mitigation strategies will be brought in. But we're not being given that evidence.